Hello everyone. We are back with another great topic. First, tell us how you are doing in the comments section. Today's topic is very important since many people have experienced it in their lives at least once. So, today we are going to talk about basic first aid for burns, types and treatment. Burns can happen to anyone at any time, but don't worry, we've got you covered with some basic first aid knowledge. In this guide, you'll learn how to identify different types of burns and administer appropriate treatment. So, let's jump right in and become your own hero in case of a burn emergency. Identifying types of burns. Burns come in all shapes and sizes, and it's important to know what you're dealing with. There are 3 main types of burns. Here are the must-have items to include in your disaster survival kit. 1. First-degree burns, affecting only the outer layer of skin. These burns are often red, painful, and mildly swollen. They can be caused by sunburn, hot water, or brief contact with hot objects. Remember, a bad sunburn is no laughing matter. 2. Second-degree burns. These burns affect both the outer and underlying layers of skin, causing redness, pain, swelling, and blistering. Common causes include scalding liquids, flames, and chemical burns. 3. Third-degree burns, the most severe burns. These affect all layers of skin and may even reach underlying tissues. The burned area may appear white, black, or brown, and can be numb due to damaged nerves. Third-degree burns can be caused by prolonged exposure to heat, electricity, or chemicals. How to treat different types of burns. Now that you've identified the type of burn, let's discuss the appropriate treatment. First aid for first-degree burns. 1. Cool the burn by running cold water over it for 2 to 10 minutes, depends on burn. Keep calm and don't panic, this will help to soothe the pain. UK Red Cross underlines that cooling the burn will reduce pain, swelling, and the risk of scarring. The sooner and longer a burn is cooled with cold running water, the less the impact of the injury. 2. Apply aloe vera or over-the-counter burn cream to the affected area for relief. 3. Avoid popping any blisters, as this may lead to infection. 4. Take an over-the-counter pain reliever if necessary. First aid for second-degree burns. 1. As with first-degree burns, cool the burn with cold water for 4 to 10 minutes, depends on burn. 2. Avoid using ice, as it can further damage the skin. 3. Apply antibiotic ointment and cover with a sterile, non-stick dressing. 4. Change the dressing daily, and watch for signs of infection. 5. Take pain relievers as needed. First aid for third-degree burns. Third-degree burns require immediate medical attention. While waiting for help. 1. Call emergency services right away. 2. Elevate the burned area above the heart, if possible. 3. Do not remove clothing stuck to the burn. 4. Do not immerse the burn in cold water, as it may worsen the injury. 5. Cover the burn with a clean, dry cloth or sterile, non-stick dressing. Additional tips for burn safety. 1. Keep hot objects, liquids, and chemicals out of the reach of children. 2. Always use oven mitts or potholders when handling hot pots and pans. 3. Install smoke alarms in your home and test them regularly. 4. Never leave candles or other open flames unattended. 5. Have a fire extinguisher in your home and know how to use it. If you have kids, we recommend to teach them how to use the fire extinguisher so, in case of an emergency, they can handle it and call the 911. Burn prevention in the sun. 1. Apply sunscreen with a high SPF 30 or higher before going outdoors. 2. Reapply sunscreen every 2 hours, or more often if swimming or sweating. 3. Wear protective clothing, such as wide-brimmed hats and sunglasses. 4. Seek shade during peak sun hours, 10 a.m. to 4 p.m. 5. Stay hydrated to help regulate body temperature. With this comprehensive guide on basic first aid for burns, you are now well equipped to handle burn emergencies and take preventive measures. Remember, the key is to stay calm and act quickly in such situations. Frequently asked questions. Question: should I use butter or toothpaste on a burn? Answer: no. These home remedies can actually trap heat and cause infection. Stick to cool water and sterile dressings. Question: when should I see a doctor for a burn? Answer: seek medical attention if the burn is larger than 3 inches, 7 centimeters, is on the face, hands, or genitals, or if signs of infection develop. Question: can I use ice on a burn? Answer: avoid using ice, as it can cause further damage to the skin. Instead, use cool running water. At the end, burns can be painful, but with this basic first aid knowledge, you'll be better prepared to handle these emergencies. Remember to identify the type of burn and administer the appropriate treatment. Stay safe and don't forget that prevention is always better than cure. And that's it for today, dear listeners. Tell us what you think about this topic and whether it helped you. Tell us about your experiences with burns as well so we can see what we are missing. So folks, that's it for today. We hope that you learned something with this podcast, and if you liked it, don't forget to subscribe to this channel and active notification bell. See you with another interesting podcast, folks. Until then, take care and have fun and be careful with fires.